Hello everyone, for this practical, I will be showing you the nursing of perineum, perineal and genital area care. Perineal care, male and female. It is also referred to as perineal care, part of bed bath. Why is perineal care important? You want to keep your patients clean and healthy. One way you can do this is by helping them clean up after they become incontinent. Use a bedpan or as part of their daily cleaning routine. As these areas are prone to infection, it's extremely important to keep this area clean. Beyond avoiding infection, there are many other benefits of proper peri care, increasing the patient's comfort, preventing skin breakdown or injury that can arise from unnecessary, preventing pressure or friction on delicate skin, preventing odors and skin irritation caused by urine and feces. Procedures for pericare differ to a bit based on the patient's sex. Patient who is bedridden and or unable to perform most of their own daily care activities, perineal care is essential for them. The genitals and anal area are both prone to infections mainly because this is where waste, feces, and urine pass through. For a person who has an indwelling catheter, proper perineal care reduces the risk for infection. Perineal care also protects the skin around the genitals and anus from breaking down. For bedridden loved ones, the risk of bed sores is high. Proper perineal care helps to keep that at bay. Cleaning the perineum helps to keep your loved one comfortable. For a person who is bedridden and who is unable to clean their own perineum, proper perineal care represents an opportunity for them to maintain their dignity. Purpose: remove perineal secretions in order to prevent infection, such as indwelling catheter is present. To promote client comfort. Materials: ovum forceps, cotton balls, feminine wash or gentleman wash, 2 kidney basin, and then water, and cotton cloth. What are indications of perineal care? First, postpartum females with repaired perineal tears. Second, patient with genitourinary tract infections. Third, patients recovering from surgeries of the genital region. Fourth, patients suffering from incontinence. Fifth, who are unable to do self-care. Preparation for the patient. Thoroughly wash your hands and medical gloves before you begin the procedure. Explain the procedure to the patient and take the consent before starting procedure. Tell the patient to separate legs if the patient is unable to do that. Caregiver will need to offer some help. Keep patients' bodies covered to prevent unnecessary exposure and to help promote a sense of dignity. Assess the condition of the perineal skin to look for any ulcers, itching, irritations, edema, discharge, etc. One of the most important aspects of pericare is checking for the signs of infections. These include swelling, lesions, rashes, sores, and boils, as these symptoms can lead to serious conditions if not diagnosed early and treated properly. Assess the need and frequency of perineal care. Ideally, perineal care should be done at least once a day. Assess the patient's mental state to follow instructions. Check for physician's order for any specific instructions and maintain privacy and respect throughout the task. Female. For our for the female, I will be using one here laminated picture of female genital, this one. First, get ready all your materials. Ovum forceps, 2 kidney basin, feminine wash, then water. After you're ready, don gloves. In the kidney basin, put water. And other kidney basin, put feminine wash with water. Into the water, then wash from the mons pubis down to anus. Discard 1 stroke at a time. Get cotton balls. Mons pubis, this. Then discard. Then cotton, this one, cotton again, cotton, dip into the water with feminine wash, dip, let's squeeze some excess water. Then labia majora down to anus. Labia majora means outside. Discard the cotton balls. Then labia minora, again dip. Discard. Repeat the process on the other side. Labia majora, discard. Labia minora, discard. And then for the feminine wash, get cotton balls, dip it in the water with feminine wash, then repeat the process like what I did from washing the genitals. Mons pubis, again, mons pubis, down to anus, discard. Then labia majora, discard. Labia minora, discard. Same on the other side. And then the inguinal area. 1 stroke at a time. Then, for rinsing the genital, repeat the step that I show you. Turn the person on their side and wash, rinse, and dry the rectal area. Then put into comfortable position. For the male, just like female, you will also wear gloves. This one. Prepare 2 kidney basin, 1 for water and 1 for gentleman wash with water. Then hold the penis using 2 fingers like this. For example, hold the penis like this using your 2 fingers. If you have cotton cloth, you can use cotton cloth, but I have cotton and then open forceps. You will hold it like this. You don't hold it like that, like this. Okay. Using cotton that has been dipped into the water, I wash the penis in circular motion downward, like this. Circular motion, then downward, then discard. After that, clean the shaft from top to bottom, shaft to bottom, 1 stroke at a time. Then, if the patient is circumcised, pull back the foreskin, then do the circular motion using the cotton ball. How to retract the skin? Pull back. Again, use your 2 fingers. Pull back like this. Then you do it circular motion, then discard. Then go to scrotum. Start from here. Scrotum. Start from here. Outside. Like you are writing a letter U. Like this. Same. Repeat for the soap. Dip the cotton ball into water with gentleman wash. Then again circular motion downward to the root. Then discard the cotton ball. Repeat the process until you finish soaping. Then rinse. Tip for the penis: do a circular motion downward. Discard on the shaft from top to bottom. Scrotum from inside to outside. Inside to outside, like you are writing letter U. Then clean the groin to anus. This one. Then discard. Same on the other side. If there's no cotton balls available, you can use cotton cloth. How do you do that? Your hand. This. Then you can use like this. Then turn the person on their side and wash, rinse, and dry the rectal area. Put the patient into comfortable position. Significance of the perineal care. Cleaning of the perineal area is very important as it is prone to infections. It should be cleaned and at least once daily, and in cases where the patient suffers from incontinence, perineal care is needed at least twice a day. Regular perineal care prevents urinary tract infections, genital infections, and also minimizes odors. Typical times of performing perineal care include as part of the daily bathing, following episodes of incontinence, and after the use of the pet